And the fact is that the Affordable Care Act has done more to rein in rising costs, make sure everyone can buy insurance, and attack the federal deficit than we've seen in years. And that's not just my opinion, that's the opinion of the Congressional Budget Office. Nonpartisan, the same one that puts out numbers that when it's handy to go after me, people trot out and say, boy, look at these numbers. So they're saying we're saving $1 trillion because of this act on our health care costs. Otherwise, we'd be $1 trillion more in the red. And that's something that we should build on, not break down. Now, that doesn't mean that the job of health care reform is complete. We still have to implement the law, and we have to implement it in a smart and non-bureaucratic way. I know that many of you have asked for flexibility for your states under this law. In fact, I agree with Mitt Romney, who recently said he's proud of what he accomplished on health care in Massachusetts and supports giving states the power to determine their own health care solutions. He's right. Alabama's not going to have exactly the same needs as Massachusetts or California or North Dakota. We believe in that flexibility. So right now, under the law, under the Affordable Care Act, Massachusetts and Utah already operate exchanges of their own that are very different. Operate them in their own way, and we made sure that the law allowed that. The same applies for other requests, like choosing benefit rules that meet the needs of your citizens, or allowing for consumer-driven plans and health savings accounts. And this recognition that states need flexibility to tailor their approach to their unique needs is why part of the law says that beginning in 2017, if you can come up with a better system for your state to provide coverage of the same quality and affordability as the Affordable Care Act, you can take that route instead. This portion of the law has not been remarked on much. It says, by 2017, you have a better way of doing it? Help yourself. Go ahead. Take that route. Now, some folks have said, well, that's not soon enough. So a few weeks ago, Oregon Senator Ron Wyden, a Democrat, and Massachusetts Senator Scott Brown, a Republican, and Louisiana Senator Mary Landrieu, they proposed legislation that would accelerate that provision. So it would allow states to apply for such a waiver by 2014 instead of 2017. I think that's a reasonable proposal. I support it. It will give you flexibility more quickly while still guaranteeing the American people reform. If your state can create a plan that covers as many people as affordably and comprehensively as the Affordable Care Act does, without increasing the deficit, you can implement that plan, and we'll work with you to do it. I've said before, I don't believe that any single party has a monopoly on good ideas, and I will go to bat for whatever works, no matter who or where it comes from. So here's the bottom line. Once fully implemented, I'm convinced the Affordable Care Act will do what it was designed to do: cut costs, cover everybody, and the worst abuses in the insurance industry, and bring down our long-term deficits. I am not open to refighting the battles of the last 2 years or undoing the progress that we've made. But I am willing to work with anyone, anybody in this room, Democrat or Republican, governors or members of Congress, to make this law even better, to make care even better, to make it more affordable, and fix what needs fixing.